All right, it's 2 minutes after, so let's go ahead and get started. So I want to welcome everybody to a two-part series. I'm gearing up for the CHNA process. I'm Monty Robertson, the Executive Director of the Alliance for a Healthier South Carolina, and we're glad to be here today to delve into the China and chip processes. We have certainly invited many hospitals, but also other partners who play a role in the China and chip process. Want to give a special thank you before we jump into things to the South Carolina Hospital Association, who has played an integral role in aligning the China and chip process across South Carolina. So thank you, SCHA. So in this first webinar, Foundations of Community Health, Understanding Hospital Needs and Challenges, again, we'll delve into the China process, what it looks like, successes, challenges, and for us to talk about how can we work collaboratively moving forward to align efforts across the state. Next slide. Waiting to advance. There we go. So before we delve into the content of today's meeting, I just want to understand how are you guys feeling about the China and chip process in one word. So I think it looks like we have a Mentimeter for you guys to scan the QR code and tell us how are you guys feeling? Are you excited? Are you anxious? What one word describes how you're feeling about the China chip process? Looks like so far overwhelm is taken over. We got excited, curious. Okay, got a wide variety of feelings: learning, interested, unknowledgeable, confused, inquisitive. Curious and overwhelmed seems to be the top feelings that we're excited. It looks like it's getting bigger. Overwhelmed is just continues to get larger, and so is curious. So you can see today there's lots of different feelings about the China and chip process. And so today we want to delve into the process, provide a greater understanding of what the process looks like, and see where we may be able to provide some resources to support the process, to ease your mind a little bit so you're not as overwhelmed by the end of today's webinar. Still got some more coming in. Great. All right, next slide. So as you can see today, we have two objectives that we want to cover. First, to gain a comprehensive understanding of the current successes and barriers hospitals face in completing their community health needs assessments and developing their community health improvement plans. Secondly, we will identify anticipated needs and resource requirements for hospitals to successfully conduct and implement the China and chip process effectively. Again, that webinar is only an hour, but we'll certainly begin the conversation and understand where those greatest challenges are. Next slide. So as a level set, just thinking about what that process looks like, and again, there may be, certainly variations to this model, but as a level set, we're understanding our process developing Chinas and chips. We want to first engage stakeholders in that process. And that could be a wide variety of stakeholders, from our hospital leaders, community leaders, even some of our state leaders who play a role in that China process. As we move down this continuum, we understand in completing our Chinas, we need to have both qualitative and quantitative data. So what does the data say from a population level standpoint, but also what does the community need? Certainly, through the process, we conduct surveys, focus groups, a wide variety of getting that qualitative and quantitative data. From there, it helps us to establish what those priorities for our communities are and the greatest need that the folks who we serve have in our respective communities. From there, we develop an improvement plan, which is commonly known as our CHIPs. So what are the strategies that we're going to implement to address those priority areas? And then lastly, we want to monitor progress and outcomes. And so this process, I think, by and large, runs very similar from the community level to the state level. So at the state level, we have the state health assessment, and we have the state health improvement plan. Next slide. So our state health improvement plan, branded under the name Live Healthy South Carolina, is a collaboration with the Department of Public Health and the Alliance for a Healthier South Carolina, who are the two organizations who are leading the process. Certainly, there's other partners who play a role in this process, but wanted to make sure we're making those connection between our community health needs assessments and improvement plans, along with our state health assessment and improvement plans. Next slide. So real quickly, we wanted to share these priorities at the state level. Certainly, your priorities at community level may look a little different, but we wanted to make sure we are intentionally showing how these processes align. And so I won't go through all of these processes, but this model may look very similar as it models the county health rankings and roadmaps model. So as you can see, we have health outcomes that we're trying to address, but then I think most importantly, we're looking at what are those different factors that impact health. So in a non-traditional way, we are developing a state health improvement plan that looks at education, income, poverty, neighborhood and community development, quality of care, all of these different factors that impact health outcomes. We're making sure we're including in the state health improvement plan. Next slide. And so many times there's questions about, well, how do we align these processes at the state and community level? And so we have launched a new initiative, actually it's been around for about 2 years now, where we are trying to strengthen the infrastructure and capacity at the community and state level to ensure that we have alignment. Next slide. So this initiative is called Collective Impact in Action, which is partners aligning for community health. Next slide. There's certainly lots of organizations who are playing a role in building this infrastructure and capacity, from our Department of Health, SCHA, CARES, Furman, the Office of Rural Health, and AHEC all play a role in developing this framework for strengthening our infrastructure and capacity for alignment across the state. And so in the next slide, we'll delve into what are those 4 components that make up this initiative. So as you can see here, we have 4 different components that are where we're aiming to build this capacity and alignment across the state. First, we're building the forward-facing dashboard. And so I know in your China process, again, you're needing that quantitative data. And so we're working with the Department of Health to actually build out a data dashboard so you'll be able to easily pull that data from one centralized place. We're aiming to launch that the spring of 2025. Secondly, which is really what this webinar today is about, is looking at how can we develop a model statewide to collaboratively develop community health assessments and improvement plans. Thirdly, and certainly many of you guys have probably heard about results-based accountability, which is a framework that we're implementing across the state for us to offer a higher level of accountability in developing our improvement plans. We'll delve into that a little bit. And then lastly, implementing a performance management system across the state. Clear Impact is the name of it. So taking what we're putting in paper and getting it into a system where we can easily see what are the key strategies, what organizations are working on these strategies, so we can have better alignment across the state. So this is really how we are building the capacity for implementing community health improvement plans and implementing the state health improvement plan. Next. So again, we're going to be focused on objective 2 today. Next slide. So that sums up laying the foundation for why we're here today. So I'm going to turn it over to Landon Campbell, who is the program manager for this CIA project. Landon?
Well, good afternoon, everyone. So I'd like to introduce our first speaker for the day, Pam Gilliam. So Pam is the director of the Center for Applied Research and Evaluation at USC's Arnold School of Public Health. She provides over 20 years of experience and expertise with mixed methods, evaluation and research, quality improvement consultation, strategic planning facilitation. She collaborates with state agencies, nonprofit organizations, healthcare providers, and other community partners to improve outcomes on various public health and healthcare issues, including maternal and child health, oral health, tobacco cessation, traumatic brain injury, substance use, access to reproductive health services, and cancer screenings. For the past 4 years, she has been involved in the creation of a statewide strategy to better address social determinants of health. So thank you for joining us today, Pam, and now I'm going to turn it over to you.
Thank you, Landon. I appreciate it. Thanks, everyone, for being here today. And I'm excited to share with you what we've learned so far as part of this community health needs assessment and CHIP assessment that we've been working on as part of the Collective Impact and Action Initiative. So I want to also recognize my colleague, Dr. Melissa Fair at Furman University's Institute for the Advancement of Community Health. She and I have been working on this needs assessment over a little over a year now. Next slide. So just to tell you a little bit more of, Monty shared this with you, but the overall goal that the Collective Impact and Action is hoping to have with this is how can we develop a model for a more statewide collaborative community health needs assessment and community health improvement plan process so that we're doing a better job of really aligning community health improvement strategies. And so our first step that we suggested was like, let's find out what people are doing. What do the various CHNA and CHIP processes look like across the state? And so that's what we really focused on over the past year. Next slide. So there were a number of questions we wanted to ask to understand. So for example, how do they vary? How do the processes vary? How do they collect data? How do the different healthcare systems collect data? How do they, is it primary data? Is it secondary data? How do they analyze it? How do they prioritize it to develop into a health improvement plan? How do they engage their partners? What kinds of resources do they have to help them conduct their community health needs assessments and health improvement, develop their health improvement plans? We also wanted to get a sense of, okay, let's talk about the C-suite, our executive levels within healthcare systems. How do they view these processes? Do they see the value? And where does alignment occur with the community health improvement plan and the healthcare system's priorities? So those were the types of questions we asked as part of this assessment. Next slide. So there were basically 3 phases to this process. The first one was a cross comparison of tools. The second one was interviews with the staff who are responsible for conducting the community health needs assessments and development of the CHIPs. And the third, which is really the process we're still wrapping up, is interviews with our healthcare system executives. So I'm going to tell you a little bit about each phase. Next slide. So this first phase was getting as much information as we possibly could from the healthcare systems that participated, and I will introduce them and recognize them in a minute. But really trying to collect any data collection tools they used, trying to understand the methods they used. Did they use surveys? Did they use focus groups, town halls, listening sessions, etc.? I mentioned the instruments, if we could get our hands on the surveys they used or any interview guides that they used to understand what types of questions they were asking. If they were looking at secondary data sources, what were those that they used and where did those data sources come from? And then doing an assessment of their final reports of their community health needs assessment and their community health improvement plan. So that was phase 1 of this work. Next slide. The second was talking to the staff. And so I want to recognize the 6 healthcare systems I know some of you are on here. I'm hoping all of you are, but I would like to thank you again for being willing to share with us. I mean, we bugged you a lot. We asked you to participate, and you were generous with your time. But you also were so willing to share your data collection tools and your reports with us. So we talked to AnMed Health, Bon Secours, MUSC, Prisma Health, Self Regional, and Spartanburg Regional. So thank you again for all of you for participating. And so in this second phase, when we talked to the staff who are responsible for these two processes, the primary questions we asked were in these following areas. So like, why do you conduct the community health needs assessment, which some people might think that's kind of a crazy question because, oh, we all know it's because of they have to do it for IRS purposes, but there may be other very good reasons that they conduct community health needs assessments. And I should point out that not all of the healthcare systems on this list are required to do that. So trying to really understand why do they value this process? Why do they do it? Understanding their data collection, analysis, and reporting. How did they develop their CHIP? We heard a variety of different ways of developing, prioritizing those public healthcare issues that arose from the needs assessment. We talked to them about their resources that they had, not just people, but funding and how that funding was used. Engagement of external partners. Who that's not within the healthcare system did you engage? Did you have like an executive committee? Did you have a community board? How did you engage folks as part of this process? We also asked questions specific to this idea of a statewide collaborative strategy. Are you up for looking at ways that we could have a more standardized approach to our CHNAs in development of a community health improvement plan? And do you see the value in aligning community health strategies? And then lastly, we wanted to get a sense of how engaged they've been in Live Healthy South Carolina for our state, trying to understand how they see what their CHNAs and their CHIPs and how those would align with our state health improvement plan in South Carolina. So that was phase 2. And then our last phase is this talking with executives. We've conducted some, but not all of the interviews with folks at the C-suite level. And really, we're asking similar questions, but mostly we're really interested in really about the alignment of what comes out of the community health needs assessment and ends up in their community health improvement plan and how that aligns with overall healthcare system goals. Wanted to get a sense of the value they see in this whole alignment, this idea of collaboration, cross-collaboration amongst our healthcare systems in aligning our community health needs assessments and community health improvement plan processes. And then also this idea of participation in a statewide learning collaborative, where we would really focus on taking what we've learned through this needs assessment process and sharing that back, but also providing best practices in data collection to ensure that you are really, what you're learning is representative of the communities that you serve and how you can better engage community partners as part of both processes. And then lastly, we really wanted to get a sense of, okay, so you've done this needs assessment before, what's your vision for it in the future? So those are the questions that we're currently in the process of collecting data. So those are the 3 phases. Next slide. So I wanted to briefly share with you just what we've learned thus far from the cross comparison through our inventory of the data collection methods and tools, and also with our phase 2 interviews with the staff responsible for the community health needs assessment and improvement plans. Next slide. So this just gives you a sense of the primary data sources that were used. So when we talk about primary data collection, that means we go out and we get the data. And so this gives you a sense. We collected this information directly from them, but as well as from their reports, their needs assessment reports. And so if you haven't, if you can see here that actually Lexington Medical Center and MUSC collaborated on their community health needs assessment. But if you'll notice, there's a variety of ways that people collect their information for their community health needs assessment from a primary data collection standpoint. And it also varies how much. And so this just gives you the breadth of all the variety of ways that folks are currently conducting community health needs assessments. Next slide. This here shows you there's the surveys. So a number of them collected surveys. And this just gives you a sense of what type of questions fall in one of these topic areas. So pretty much all of the surveys collected demographic information on the individuals who participate in the survey, and that's what the check mark is related to. So for example, you see the insurance coverage. So if we say data collected at the individual level, that means we're asking, do you have insurance coverage? And then data collected at the community level, it might be something that's more general, such as like, what do you think are the overall health care or public health issues in your community? Just to give you a sense of the differences between a check mark and an asterisk. And then these were the primary topic areas that we saw that was covered in surveys. So child independence health, access to health services, health priorities, quality of health, like overall health, insurance coverage, community safety, health information, education, healthy eating, physical activity, and social determinants of health. So those were the primary topic areas that we saw across all of the surveys that we had our hands on. Next slide. Okay, so secondary data sources were really interesting because they varied. And not only did they vary, but like CDC, for example, would have, you had everything from BRFSS to cancer data from where all of the data came from the CDC, or for example, even with DPH, the primary one we saw was cancer, but we also saw other data collected through secondary data sources. So these were the primary ones we saw mentioned. So CDC, the Department of Public Health, Robert Wood Johnson Foundation with their county health rankings, and the U.S. Census Bureau. But even within each of those data sources, it just really varied on what data was collected from those different data sources. So that was interesting. So yes, some commonalities, but more, I would say more differences than common data sources. Next slide. Thank you. Also, engagement of internal and external partners. So we felt like this was really important to understand in terms of engaging with partners. And so this, if you participated in one of the previous webinars, Melissa Fair presented, but I thought this was important for us to share again. So we had information from 5 of the 6 healthcare systems in terms of the partners that they engaged. Many of them actually all of the ones of the 5 that we had this information used a consultant. So they hired an external consultant to help collect data. Now, it could have been they just used them for one aspect, for example, like a secondary data, like collecting all of the secondary data sources and doing the analysis and reporting, but they all used a consultant at some level. Also, we saw that if there were local academic partners that they could engage with to help them with the data collection, analysis, and reporting, they were part of that partnership and collaboration to assist with that. And so that relationship may have looked very different. They could have also been their consultant, but they that they hired, but it also could have been more of they just played a role on a committee in terms of helping decide what types of data that should be collected. And then also, it's really interesting to point out that 20% of the systems engaged community partners. And what I mean by community partners is not just any external partner, but really folks within the community. They could have been like a faith-based member of the community. They could have been a person with lived experience, but 20% of the systems engaged individuals who are seen as community leaders in their communities. So we wanted to point out those similarities and differences as part of this needs assessment. Next slide. As it relates to health priorities, so across the 6 healthcare systems in which we had their community health needs assessment reports, here's where you found the data. So behavioral and mental health was found as one of the top priorities. And then you have obesity and access to healthcare coming next in line, then heart disease and stroke and diabetes. And then the other category, which was, of course, those different health priorities that didn't rise into one of these other areas. And that could have varied depending on the healthcare system. Next slide. So the last thing I want to highlight as part of wrapping up our phase 2 analysis while we're also conducting our interviews with executives of the healthcare systems. So these are the key takeaways that we've had thus far. One of them is that most healthcare systems see this as more than just meeting the IRS requirement, which is a good thing, right? We don't want this to be treated as just okay, check, we did what we were supposed to do. That they really do see value in conducting a needs assessment to really be more in tune with what the public health issues and priorities are of their communities, and really thinking about what their role is as a healthcare system to address that. Secondly, data collection looks different. It looks different across, and a lot of that is really just dependent on the resources that those healthcare systems have in terms of whether it's hiring staff or consultants, how robust their data collection process is. Those are the things that come into play as part of the data collection process for community health needs assessments. Another takeaway is that there are challenges moving from the community health needs assessment to the community health improvement plan. So I think where we heard healthcare systems struggle the most was, okay, data collection seems to be more clear cut in terms of what the process looks like, but how do you take what you've collected from the community health needs assessment, and what is a really engaging process for the development of a community health improvement plan? That transition from like the CHNA process to the CHIP seemed to be more of a challenge for healthcare systems. And the last 2 takeaways is healthcare systems really see the value in the idea of a statewide alignment of processes. This is not an area where they see themselves as in competition with one another, and more of like how we can better support the state and our communities. And then lastly, there is a disconnect between healthcare systems, community health needs assessments, and community health improvements plans in Live Healthy South Carolina. So this is something that we've already talked to Monty about, like how can we do a better job of engaging healthcare systems and their community partners in the statewide health needs assessment, as well as the health improvement plan. And also, how can we better align them? How could what we learned through our community health needs assessments and what's prioritized and developed into our community health improvement plans, how can all of that feed up into our statewide health improvement plan? So those were, as of today, our big takeaways from this needs assessment. And our plan is, as we finish wrapping up, we'll have webinar number 2 in January. And Dr. Melissa Fair is going to be presenting on our overall findings as we wrap up this needs assessment. And so I think that is my last slide. Thank you for giving me the opportunity to share with you.
Thank you again, Pam. So while we're about to go into our next session, first thing I would like to do before beginning our panel today is just to introduce our moderator. So Angel Bordone is the Director of Community Health and Innovation with the South Carolina Hospital Association. So in her role, Angel leads the community health and equity efforts. Previously, Angel worked with Prisma Health in community health and information technology. And in these roles, she led the health system's strategies for community health needs assessments in 2016 and in 2019, and the launch of the expansion of the school-based telehealth program, as well as research and development for enterprise business intelligent and population health technology strategies. So without further ado, I would like to turn it over to Angel to introduce our panelists today.
Well, thank you, Landon and the Alliance, for the warm welcome and for the opportunity to facilitate this discussion. I am very happy to have 3 passionate webinar participants that will share their experience with us. And so I'm going to get us started by introducing these 3 panelists. And for the sake of time, since we have about 25 minutes to engage in this discussion with them, I'm going to keep their bios really brief so that we can hear from the experts themselves. So to get us started, we have Michael Cunningham, who is with ANMed Health. He currently serves as the CEO of ANMed Cannon and the Vice President for Community Health Partnerships with ANMed Health System. And he has been with the health system since August of 2009. And before being in that role, he served in the in county government from 1997 until 2009. He has degrees both from Clemson, go Gamecocks, and USC. Next, we will introduce Kimberly South with Prisma Health. She is a community health manager with Prisma Health and has been with the health system for more than 12 years. She has an undergraduate degree from UNC Chapel Hill and a master's degree from the University of South Carolina. And in her role, she works with all things community, their school-based health program, their community partner investments, and has worked on the CHNA since 2013. So I'm very happy to have Kimberly on the call with us today. And last but not least is Miss Cindy New with Self Regional Healthcare System. Cindy has more than 20 years of experience in healthcare, and she currently serves as the Director of Community Health and Health Equity. And she has certifications in diversity, equity, and inclusion, results-based accountability. And I really like this last sentence, so I'm going to read it verbatim. It says that she is dedicated to implementing comprehensive healthcare programs that prioritize health equity, social determinants of health, and community well-being, fostering healthier and more inclusive communities. So now, just to give us the kind of lay of the land of the questions that we have, the questions that we will ask first are actually questions that have been submitted by all of you as participants. And so we have taken those questions. We will use those to engage these 3 experts in conversation. And then towards the end of our discussion, the goal is for you to have the opportunity to ask additional questions that you may have, whether they're in the chat or unmute and ask them. So panelists, the first question is one where I would like to hear from all of you, all 3 of you, but the rest of the questions, feel free to jump in and answer, but we're not required to have an answer from everyone. So the first question is related to successes and barriers. So I'd like each of you to either share a specific success story that you've had, and with that success story, what contributed to the success, or share a specific barrier. And if you choose to share a barrier, tell us how you overcame that barrier. And so I'm going to go in order of intros. So Michael, if you could tackle that first, Kimberly, you next, and then Cindy, you after that. And then we can move to just the open questions.
Okay. And again, I'm Michael Cunningham with ANMed Health System, and thanks for the opportunity to be here. I'm someone who said I feel encouraged about the community health needs assessment process and what it can lead to. There's a number of things that I'm really proud that our health system has been involved in, that I think the community health needs assessment precipitated and was a catalyst for some of those things happening. Two in particular. One is our community's safety net council that is operational. And because we use focus groups from across our community, one of which was the not-for-profits to kind of help gather information for our community health needs assessment, we were able to see that, hey, there is a great opportunity to have those not-for-profits, state agencies, local governments meeting consistently and talking about how can we do a better job of coordinating our efforts. And I think our community health needs assessment was really helpful in getting that started. I will never say that our Safety Net Council was an original idea. Renee Romberger at Spartanburg Regional was the first one to introduce me to that concept. And so we try to copy that as closely as possible. But that was one of those things that our community health needs assessment, the process itself helped to, I think, get our Safety Net Council going. And then consistently, they have been great contributors to the information that we're seeing. Another one, if I could just add one more quick one, is that we identified substance abuse or misuse as a huge issue in one of our earlier community health needs assessments. And that allowed our health system to partner with an upstate group called Favor to begin to provide interventions in our emergency department for people who present with substance misuse disorder. And a very similar program is happening here at ANMED Cannon, the ESPERT program that was funded through DEODIS. And so that was one of those things that was an identified need in the community health needs assessment, and that we took some action to get some tangible results in place. The barrier is always making sure that we have the right people around the table as it relates to the community health needs assessment. And for the hospital system, how do we do a better job of aligning what we find with the community health needs assessment with our actual hospital strategic planning process? And so sometimes that there has been a gap there, not necessarily a barrier, but just a gap with what the system is doing as it relates to strategic planning, and then aligning that with what we find as what the community says are needs through the community health needs assessment process. And I'm happy to say that we're in the middle of our latest one. And one thing that I learned, I had a chance to attend AHA's Accelerating Health Equity Conference this year. And one of the suggestions was actually including someone from strategic planning as a part of that internal kind of steering committee. And we're able to do that this time around. And so they've been involved from the very beginning as we talked about how we're going to structure it, past results, and then they will be on the front end of seeing what those results from our latest community health needs assessment looks like, so they can help us begin to integrate that into our strategic planning process.
Thank you very much, Michael. You started us off strong, giving us one of each, and a really good response to that. I particularly appreciated how you shared how the CHNA is really an opportunity to catalyze strong partnerships in the community. So thanks for sharing that. Okay, so Kimberly, you're next up. Give us either a success or a barrier related to your process.
Thank you, Angel, and thank you everybody for attending. To talk about success, let me first take us down memory lane, if I may. Something that was a huge success, and I have nothing to do with it, but I love to talk about how the CHNA has really changed our landscape of community health. In 2013, dental health issues rose up to one of the top priorities for not just the state, but definitely here in the Midlands. And what happened from that is a lot of partners coming to the table, a lot of health systems, a lot of partners coming and making sure that dental health was addressed. And that created not just dental health, but it was more of an access, because people were coming to our emergency rooms for dental pain and not getting the need that they had. A lot of that, there was political factors with that, legislative factors. But what happened is that from the CHNA, from an action plan, from an improvement process, we have what's now called Well Partners for dental and vision services here in the Midlands that really focus on Richland, Lexington, Fairfield, and probably a few other counties to address these issues of dental and vision problems, especially for people who get in a loophole or who are underserved. So I just want to say that the CHNA across our systems really makes a difference. We can really put our heads together and create a lasting solution and a very much sustainable solution for our communities. Another success I want to highlight on is we had 7,600 surveys, and I know that was kind of the big outlier of that. We were fortunate to really partner with our marketing team and strategize how do we get the most responses from our upstate and our Midlands area, because that's a big landscape. And so what we did, we used a combination of addresses from both patients and non-patients using a CRM system to pull together a list probably of 10,000, 15,000 people. And then from there, we got to 7,600 responses. Those came in both electronic and in paper. We still have a lot of citizens and a lot of residents who love to get that paper. We did spend some money, an investment to send those out and then provide a response back through a prepaid mailing. We also used an electronic version as well. We definitely got more on the electronic side, the digital side, but thank goodness for those paper surveys that come in. So those were some successes over the past few years. Barriers, I think we can all agree that, we have a lot of data out there and a lot of platforms that we put data in. So over the past few years, I'm sure you all understand, you get different EMRs, you get different ways that you show performance and outcomes. I think that's a barrier, but that barrier is, I think, an opportunity for Live Healthy and for us to come together and really have one main way of how we measure the success of these CHNAs.
Thank you so much, Kimberly. Two great success stories, and then leading us to opportunities together. Last but not least, Ms. Cindy New, now you get an opportunity to share your perspective.
Absolutely. So our last 2022 survey was actually my first. I always partnered within the survey, but it was actually my first one with it being under my umbrella. So thank goodness during that time for the Alliance's CHNA Collaborative, because that really kind of helped me get through that process. And so I think a huge success for us too was just the getting the surveys, but also that understanding how that data reached back at the state level. So I loved using the actual shared DHEC survey because I could see the data across the state and then also per community. Like a lot of us with our health systems, we represent multiple counties, and so getting the surveys out there, and then of course the data collection. I love that piece, but I love data. I think too, just speaking to going back to what Michael said, like, this became part of our health equity strategies, a lot of our priorities from our CHNA. We also did learn too that it didn't always align, or the timing didn't always happen just so that it could be a part of some of our strategies. So I look this year at really aligning that better. And even when we think through our, we have a community health foundation here at the hospital. And so now we ask those participants, hey guys, when you're submitting for funding, it needs to align with our CHNA priorities. And so that's really helped there. And then as far as barriers, I think for me, though, it was my first time, but also I feel like at that moment it was Cindy New's responsibility to get the CHNA completed for the organization, whereas this time around we do have a much larger buy-in and a much larger team within the organization and in the community that's going to help and that's going to take on that responsibility where it doesn't just fall under the community health department's responsibility.
You know, Cindy, I really want to lean into that last thing that you said, because I think that was a theme that was woven through all three responses, that you three may be the leaders or the faces of this work internally, but it really takes a village. It takes that internal and external partnership in order to create real success in this work. So thank you. So now we move into rapid fire portion of the panel, where we want to get as many of these questions that were submitted to us as possible. And so in order to do that, I'll ask a question. Whoever wants to respond to it, you can, but I won't request that all three of you respond to it unless you are all itching to share something in particular. So the next question is something that's personally something that I'm really passionate about: community engagement. We heard Pam say that in the work that they've been doing, only about 20% of the health systems that they've been talking to have engaged community members with lived experience in this work. And so I would love to hear, for those of you that have, what strategies have been most effective in engaging diverse community stakeholders and ensuring their input is able to shape your CHNA CHIP initiatives. And then I have a follow-up question for that, but I'll pause and just start there.
So one thing that we've done just over the past couple of years is making sure that it's not always me, but somebody on our team, we have 7 counties, is involved with community coalitions and sits on those committees, on those coalitions. And so that, again, helps foster the community partnership relationship. But even more so, shout out to our United Way with our current maternal health program. They actually hosted focus groups on our behalf that we were able to participate in, but getting the voice of the community. Michael, I see that you guys use that a lot at AMED, and I definitely want to add that into the mix for our CHNAs this time around. But I think that is huge, as being an integral part in the community, in those coalitions, so that you can reach the members.
Yeah. And the only thing I'll add is the being aware that you're serving more than one county and the differences even within those counties. And so that was, if you notice with ANMED, initially we only did focus groups, and we tried to geographically and otherwise make sure that those focus groups touch different parts of the county and to record those results. And even inside the city of Anderson, we looked at existing kind of community groups that were convened sometimes by city council districts, sometimes by our United Way and other groups, and we want to try to piggyback on those. And I know the one is on here, and one that we did as a focus group is that each year we would do a Hispanic health fair, and so we're able to piggyback on that to do a focus group specifically for that community to get their feedback on both barriers and opportunities. And so just that awareness of the variety of areas that we're serving as health systems, and the fact that we need to get voices from all those places, and being really thoughtful about that is really, really important about getting that feedback. This year, we're in the middle of our latest community health needs assessment, and we have added a survey instrument in both English and Spanish, and we pushed it out via MyChart. And so we were hoping for about 1,400 responses, and we are over 5,800 responses on our survey instrument. And so that, we hope, will give us an even broader array of responses and feedback that we just have not done before. And so shout out to Clemson University, and who is our partner in this work, and their public health students, master students, for collecting and now summarizing that data for us in the coming months.
Michael, I'm loving how you embedded a success story in your answer related to community engagement. Kudos to you. I'm going to jump around a little bit on our questions, because I think also in Cindy and Michael's responses to the last question, it makes me think about the resources. It takes resources to do this work. And so I would love to hear from your perspective, what resources or support do you think that hospitals need so that they can streamline the process, keep making it better every time in a way that helps them have achieve meaningful long-term outcomes in this work. So whoever wants to jump in on that one can.
I'll jump in some on the resources part because we are looking forward to really aligning with the toolkits. I think are very important, especially as we go from year to year. I'll embed a little success story in here as well, where we have used at Prisma the past 2 CHNAs now, the very similar survey tool and whole toolkit. So questions that are being asked and questions that are being or discussions that are happening are similar to the years prior, so that you really can get a good feeling of progress or maybe not progress and opportunities. So the resources with, I mean, it looks like everybody's using consultants, mostly everybody's using academic partners. And now with how we are going to look at the RBA as a metric in part 2 of this, but also really just this type of webinar, having all of these groups together, I think is going to align us, and how SCHA and Live Healthy SC are really dedicated to, let's have one overall state plan. Let's have one overall state health community where we look in our micro communities, right? And leverage some of the data that we're getting from everywhere. Because mental health is still at the top. There's no question, and there's pretty much no doubt that that's going to end up in our next CHNA. But that gives us those opportunities. So having that centralized, consistent toolkit that we all use, I think is going to be a huge benefit.
Thank you so much, Kimberly. Now, I have a few other questions, but for the sake of time, I want to recognize what's in the chat and also give our attendees an opportunity to ask questions. So one, I want to highlight, Chris asked, let me go to that. Well, number one, you guys are getting a lot of kudos in the chat. So yay, great group. But one of the questions that Chris Collins asked, is anyone using Access Health clients and or community health workers to reach underserved populations? And Cindy, I see you doing a rapid head nod. I feel like you have an answer to that one.
Yes, so part of our of course community health team are our Access Health community health workers. So they too are taking on kind of the responsibility of getting feedback not only from their clients but also from their partners and their providers.
And Cindy, can you give a 30-second elevator pitch of what Access Health is for those that may not be familiar with the program?
So Access Health is a Duke Endowment funded program that assists individuals who do not have insurance in our state with access to primary care, specialists, social determinants of health. So really having that care continuation and navigation for individuals who otherwise wouldn't have access to the services.
Thanks, Cindy. Michael, did you have a comment on that one?
No, I was just nodding. Great work of Access Health. I see Angel Williams, who is our Access Health lead at ANMED. She's on, and she's been very involved in our community health needs assessments. We look forward to engaging community health workers more and more in this work. And I think our community health needs assessment is helping to outline how important that work is, and it will be very supportive of that.
Great, thank you. So I have time for one more question, and Landon's going to kick me under the table if he could, because technically I don't have time for one more question, but I'm making time for one more question, everyone. And I wanted the question to be good. So let's talk about sustained impact of this work, right? So how do you ensure that this just isn't a process that you're checking the box, but that your CHIP and CHNA initiatives result in sustained improvements over time for those that are underserved in your communities, and also aligns with the needs of that community?
I know that one thing that we, and I think Cindy talked about it, Michael, as well, but whenever you can tie the CHNA to a grant, perfect case, HPHC, Healthy People, Healthy Carolina, goes right along with that, with all those priorities, right? So, and that's sustainable, at least for 5 years right now. And through that grant, we have to build in sustainability to that. So I would say tying it to your grants that that you're going to make part of your everyday process. That's one thing that comes to mind for me.
And guys, for the sake of time, thank you so much, Kimberly. But we have 3 minutes left, and now I'd like to turn it back over to the Alliance so that we can close out appropriately. So, Landon, it's all yours. Before I do that, thank you to our panelists, everyone. Give them a virtual round of applause for their engagement today. And now, Landon, it's back to you.
All right. Well, thank you all for your time this afternoon. We're going to quickly pull the slides back up, and we have a couple more things that I'd like to touch on really quickly before we end our webinar today. All right. Well, you guys have already seen the first slide, so I would like to share another opportunity. So this is really just going to be the second session that we have for our webinar series. And this second session, as it's already been previously mentioned, is going to mainly cover results-based accountability and the framework associated with it, and how that enhances the CHIP process. So we'll be holding that on the 14th. And you can either utilize the QR code that you can see to the side on the slide here, or you can go to our website in order to share this information out if you would like to share it with your networks. Next slide really quick. Thank you. So I would also like to share another opportunity that's been previously mentioned briefly, provided through our collective impact and action work. So as Monty mentioned earlier, we have partnered with the South Carolina Office of Rural Health and SCAHEC to provide trainings on results-based accountability. So these trainings are free, and they consist of an online self-paced training in addition to an in-person, in-depth workshop series, which will be offered intermittently over the next several months. If you would wish to learn more, please contact me after the session ends or utilize the QR code that you see on the screen for that. Next slide. So I'd also like to mention our upcoming summit. We will be hosting our 7th annual Health Equity Summit in Columbia on April 17th, 2025. We'll be highlighting some of the key health equity work occurring in our state and are still looking for presenters. So that's one thing I do want to bring out. Our deadline for those proposals for our presenters has been extended through close of business this Friday. So if you guys have any in mind, please get those proposals in by Friday. And for more information about the event, as far as if you want to register, visit our website, or once again, use the QR code that you see at the top of your screen to do so. You could also follow up with us if you have any questions or concerns regarding the summit. Next slide. So this slide is pretty important. I would like you guys to all utilize this QR code. This is our evaluation slide for today's webinar. We are looking to be able to improve this experience going forward. So if you don't mind, the survey shouldn't take more than maybe 3 to 5 minutes to complete. We'd like to ask as many of the participants that are able to do so today within this coming week to complete that evaluation for us. And next slide. So lastly, before we close, I would like to take a moment to thank all of our panelists and Pam once again for your time today, as well as all of our participants that joined the call. We would like to continue to engage with you guys on our work. So please stay tuned, be a part of our newsletter, be a part of the upcoming webinar series, because we are looking to provide additional resources and content, including a standardized survey tool, some standardized data dashboards that will be useful for the China chip process, and some more resources for this community going forward. So for those on this call that would like to learn more about this work, please either bug us via email, follow us on social media, or feel free to join our monthly newsletter. And the way to do so is available through our website. So thank you all again for your time, and I hope you all have a wonderful rest of your week.